Good morning, everyone. It is Tuesday, November 23rd. Welcome into the Morning Medical Update. Coming up today, this year, many families will gather for Thanksgiving for the first time in nearly 2 years. Today, we've got you covered from food safety to properly prepping that turkey to prepping ourselves to gather with family who may not always share the same views about the pandemic. They also may be unvaccinated. It can be a really stressful time as it is. So we have brought in the experts to help us out this morning. So make sure to get your questions sent in to us. Do that through YouTube, Facebook, Twitter, and of course, the Medical News Network. You can email us there. You can find links right there on your screen. So get those questions coming. But first, let's get to Dr. Dana Hawkinson joining us with our numbers. Good morning to you.
Hi. Our numbers are holding pretty steady, which is good. You know, we would certainly like less than we have, but we have 18 active infections with 6 in the ICU and 2 on the ventilator. Still 15 in that recovery period, but a total of 33. Unfortunately, Hayes has 16 active infections and 6 in that recovery period. So about up where we are for active infections. And again, unfortunately, they have a smaller facility, and so that is a big capacity issue for them.
So looking back this time last year, when did we start to see those numbers going up when we saw that big surge around this time?
Yeah, I would have to look back.
Okay, not to put you on the spot.
Probably around December, January.
Okay, so we started seeing those numbers going up in December. Okay, curious your thoughts about what we may be looking forward to that. Not as bad as this time last year?
I would have to look.
Okay.
I don't know off the top of my head.
I was asking
with everything else swimming around in there.
I was asking for
know.
your forecast. Okay, we will move on.
But,
okay. So,
well, again, we do know the cases are going up in the nation and around the metro area, and so I think it's going to be waiting these next 2 or 3 weeks to see how the increase in the 7-day rolling average of cases translates into hospitalizations, because that is more of what we are concerned with. It's people going to the hospital and coming in to the ICU and filling those beds. So I think it's really going to be a matter of waiting to see what happens in the next 2 or 3 weeks before we will fully know.
all right, let's see if we have any reporter questions on the line. Good morning. We are good to go. Okay, so again, get your questions in. We'll get to our community here in just a moment. But first, 2/3 of Americans plan to host a Thanksgiving Day gathering with the same amount of people or even more people as they did before this pandemic even started. That's according to a new Monmouth University poll. So here's a scary number to dish up for your Thanksgiving meal. Check this out. According to the CDC, 1 in 6 people will get some sort of foodborne illness during the year, and that'll include, of course, Turkey Day. Like we don't have enough to deal with this pandemic. Now we're dealing with food issues. So let's turn to our guest this morning. Joining us is Dr. Elizabeth Silver. She is the managing director of the Poison Control Center at the health system. We're also joined by Dr. Jessica Hamilton, a psychologist also here at the health system. So we're going to be talking about food and our body's health and also our mind health as we head into the holidays and gather with our family. And we have questions. If you have questions for Dr. Hamilton, get those in, because I know she's got to get to her patients today. So we're so glad that she took some time with us this morning. So if you have them for her, send those in. We will get to those first. Dr. Silver, I want to talk to you. We talk about 1 in 6 people getting sick each year from foodborne illness, something I think we don't really think about unless it hits us personally. What are some of the most common illnesses that you're hearing about during Thanksgiving, and why?
Yeah, that's a great question. There's a few different types of organisms that can cause foodborne illness. So one of the big ones we think about from a bacterial standpoint are Salmonella, Campylobacter, and these are because that they actually are contaminating raw poultry, raw meat that we're often handling with turkey around Thanksgiving time. And there's also still viral-borne foodborne illnesses like the norovirus. So there's several different organisms that are pretty common, but the big ones I think of are Salmonella. There was a link or an outbreak in 2017 to 2019 that the CDC had talked about linked to raw turkey products. So that's the big one that I sort of think of. I don't know if Dr. Hawkinson has any other things to add there.
Yeah, no, I mean, I think you're exactly right. Raw things, not fully cooked, but also things that have been cooked and then cool down and are allowed to sit for a while are also can be sources of infection as well.
And we'll talk about that, but I want to know some of those foodborne illnesses you discussed. How concerning are they? I mean, we hear about Salmonella. That sounds, I'm always washing stuff down and making sure my kids aren't touching anything. But can it affect people differently? Can somebody get some sort of Salmonella poisoning or get illness and then be fine, and it may affect somebody else really drastically?
I mean, absolutely. Depending on how much they get exposed to, depending on their age, other risk factors. Some people might, just have some nausea, vomiting, abdominal pain, diarrhea. Other people, depending on, again, the actual strain or the bacteria, you can have bloody diarrhea, they can have fever and more kind of systemic symptoms. So it can be life-threatening in some
Life-threatening,
circumstances.
something would get you to the hospital. So do the phones ring off the hooks this time of year? I mean, do they? What kind of calls do you get at the call center? And just tell us a little bit about what's going on at the call center, because it's
Yeah.
actually housed here at the health system,
Yes.
something a lot of people may not know. So just tell us about that, and then what kind of calls you're getting.
Yeah. So the Kansas Poison Control Center here at the University, Kansas Health System, we are the one poison center for the entire state of Kansas. So we answer calls here at the health system where we have, patients that might come in, local patients to Kansas City area, but also across the entire state. And we answer calls regarding anything and everything. Anything is a poison. The dose makes the poison. So whether it's a medication, whether it's carbon monoxide, whether it's a spider or snake bite, plant ingestion, we're there for those type of calls. This time of year, we have a lot of children that make up, honestly, the majority of our cases, and that's true for this time of year as well. Probably about 50 to 60% of our calls are in kids that are less than 5 years of age, and so around the holiday times when everyone's traveling, people are getting together, people bring medication with them or go to homes that might have medication that's not stored appropriately. So that's a really common type of call that we get, of kids getting into their family's medication that's not appropriately stored. Alcohol is really commonly ingested around this time of year, so kids that get into that as well.
And you really are seeing those type of things.
Yes.
Because I know every time my mom comes, and she's probably watching right now, she dumps her big old purse right there on the floor. And before you know it, my kids are going through it and getting stuff. Now, they know better not to get into medication, but I can see where a younger child will go over and they'll start rummaging through stuff, something new.
Yeah,
and take it.
Especially if it's not something maybe found in their own house. It looks new. It looks like candy to them. A lot of the alcoholic drinks might look like juice. They see their parents drinking it. Kids like to imitate behavior, especially young children. This time of year, it's also a bit colder, so we do start to see a bit of an increase in carbon monoxide related calls. So that's an important reminder to just have a carbon monoxide detector on hand. And then unfortunately, we do still have our adolescent and adult exposures that might be unintentional therapeutic errors. Maybe they miss a dose around the holidays because they're so busy, or self-harm attempts are still a big chunk of our calls as well.
When we talk about poison control, I mean, this is an underutilized phone number that people are not using and you wish they would. What's your message about that?
Our message is that call us. We are a completely free service. We are 24/7. We have people staffing holidays, weekends, middle of the night, you name it. It is completely voluntary, but you might have an exposure to a cleaning product, or your kid might take a medication, or eat a weird berry that was found outside on the bush and think it's probably okay. But if you don't know, there's absolutely no harm, any risk in calling to find out.
And no harm in the fact that I think there's a lot of time, we talk about, I always say, major parent failure when you let your kids get into something, but we don't want parents to feel concerned about calling when,
Exactly.
Maybe they've left their kid unattended for a moment. We've all done it, to be able to say, hey, oh my gosh, they got into something. I wasn't watching them, but it's okay to call, right?
Absolutely. I think one of the things that people don't realize is just how common these type of calls actually are. Whether you're a new parent or even the holiday time, there's so much that people are juggling between hosting, cooking, decorating, all these things going on in their life. It's easy to turn your back for 1 second, and kids are tricky. Kids get into everything. So it might be new for you, but trust me, we've heard it all, and we are just there to triage, to relieve any type of nervous energy that you might have around the exposure, or to appropriately refer you in if it's necessary that we think you might need to get help.
To 911. So if it's something more than what poison control can handle, you'll send them to 911.
So depends on how severe the exposure is. If the patient is actively unconscious, if they're seizing, if there's worry that they're not able to be aroused or they're not breathing, absolutely we have them call 911. If it is just an ingestion where potentially they got more than what we would feel comfortable at home, and the child or person, whoever the exposure is doing okay, there's usually time where they can actually drive themselves or have someone else drive them, depending on what that is, to the ED. So it depends on what the caller is able to do as
Okay,
well.
all great advice, especially as we mix and mingle with our, family members,
Yes.
young and old, this coming holiday season. Before we get to Dr. Hamilton, what's the number? Just so people can maybe jot that down, put it in their phones right now.
Our number is 1-800-222-1222.
Easy enough. Get that in your phones. Okay, let's turn to our mental well-being during this holiday season. We know it's a stressful time. We got work, finances, trying to keep all the plates spinning. And as we know, not everyone in the family is always on the same page when it comes to COVID and this vaccine. Lots of issues going on with that. So let's bring in Dr. Hamilton again. We only have her for a few more moments. So if you have any questions for her, go ahead and get those in right now. But Dr. Hamilton, what is the best advice you have for people worried about just interacting with family members who did not get the vaccine or have opinions about people who did get it?
Yeah, I think that the first thing that I would suggest is trying to keep our idea of what we do have control over right now, and not put judgment or placement of other people's choices that we don't have control over, and because that just works us up emotionally. So if you can focus on the things you do have control over right now, that can actually really help reduce anxiety. One of the things that I encourage people to do is to educate themselves, and education by listening to the morning show like this today and learning what Dr. Hawkins says, and reading the CDC guidelines, understanding what your risk factor is. I also encourage patients to talk to their physicians. Each of us is individual. We all have our own risk factors. And so knowing what your level of risk is, if you've been vaccinated and or if you're going to be around somebody who has not been vaccinated, knowledge is power, and it allows you to make the best decision possible for you. After that, it's really identifying what you feel comfortable with, what choices and decisions that you have, whether that be deciding, maybe this year is still not the year that I am ready to take me and my family to a larger gathering for X, Y, or Z reasons. Or it could be that you do feel comfortable, but the gray might be that you sit at a separate table, and just having open discussions with family about what you are comfortable with and why, and that it's not because you're angry or irritated, even if you might be. You're communicating with them what you feel comfortable with, and if they're willing to make those accommodations to keep everybody healthy, happy, and safe. And again, if they're not willing, then this may just not be the year to do those larger gatherings.
Yeah, it's tough. It's almost like, and it's sometimes easier said than done. If everybody is in a really great space with this, those conversations can be easy. But it's almost like easier when just everybody had to stay in their own house. Now you've got the decision when you have unvaccinated mixed with vaccinated people, and now people are having a tough time just having those conversations, because now it feels like you brought a judgment into it. So that is tough. But how do we keep the anxieties in general? I mean, this is just as we head into kind of the kickoff of the holiday season with Thanksgiving on Thursday. How do we just keep our anxiety at a minimum and try to enjoy it and decrease some of that stress?
After listening to some of the stuff with the risk factors associated with infection too for food, there's multiple things going on for all of us right now, and then the juggling of who's bringing what food, and there's lots of different things. And so I just tell people to pace themselves, really creating a list or a schedule that you can adhere to, being comfortable saying no, that's too much for me right now. And try not to do it all last minute or all out in one fell swoop, because that usually does lead to a higher risk of anxiety, and the stress level gets harder and harder to manage. So the more that you can pace, the better that you will be.
So how do you keep politics out of the dinner table space?
That's a great question.
Wish we knew, right?
Well, I mean, I think that whoever is hosting can really start off by just sending out that email of like, this is what people are bringing for food. This is what people what time and I'm expecting people to arrive, and hopefully they also say what time they're expecting people to leave.
That's always my number one. I always back it up. This is when I want you to leave. So how long does it take for us to eat, clean up? Yeah, right?
Exactly. But then also being willing to end that of like, these are going to be some really great conversation topics, but I'm going to ask that we keep these things off the table this year. And then also including things as you go that keep conversations steered in different directions. We got a game last night at Target that's a meme game that I have no idea what it is.
Oh,
but
what do you meme? It's
Yes.
hilarious. You will love it.
Okay, good. I have no idea what I'm doing, but my 14-year-old was like, Mom, we have to get this. So we'll see how that goes. But keeping people engaged in activities and productive, healthy conversations. Most of us haven't seen each other in a prolonged period of time. And so we should have a lot to catch up on. How are the kids? What have they accomplished? How are people adjusting? What are they looking forward to? What's your first vacation going to be if you haven't taken one yet? And if you have, how was it? Lots of different things are out there right now to discuss that are not political in nature. And so I would just encourage people to try to steer the conversations, even if it's in a jar or with a game, that keep people engaged in those healthier topics.
Yeah, those jars that have little conversation starters.
Yes.
And I think it's great. I think you're right. You're there with each other for such a short amount of time. It's just really, it's kind of like that don't go there kind of advice where not necessary to talk about. What about people who just struggle with seasonal depression during this time? I mean, it just seems like it's that feeling of, oh, here it comes. And some people have it worse than others, but that feeling of, okay, let's get on with it. Let's get it over with. How can we manage that feeling and also support our friends and family who might suffer from that?
Absolutely. Especially as the time has changed and the sun is going down earlier. Actually, that creates that sense of increased melatonin, which makes us sleepy, and then we're wanting to sleep more, and we start doing less activity as well as physical activity like walking, running, engaging in those types of behaviors. I've actually started encouraging patients, to keep more lights on until about an hour to 2 hours before they're ready to go to bed or what they would consider their normal bedtime, as well as making sure that they're still engaging in physical activity, because that really can boost our mood and help keep our sleep-wake cycles up at the right time if there is such a thing. But your schedule, keeping it regulated, can be very beneficial to seasonal affective disorder, as well as making sure that you're engaged in those behavioral activities that keep your heart pumping and you engaged in a physical way.
Well, Dr. Hamilton, I think you just make a good point. It has to be intentional. Happiness doesn't just always just happen. You have to work on your moods, and you have to work through, like you said, the darkening early hours, and just exercising and the endorphins, and just keeping your mind right.
Yeah.
I know you have to get to patients, but just go ahead. I want to give you some time just to let us know kind of what else you want us to know, and some other advice you may have as we head out of here.
Well, I would just say that, ultimately this season is supposed to be about being thankful and enjoying our friends and our family. And if we focus in on that, the anxiety about the other stuff can dissipate, because I know my best friend is not going to care if I end up giving her a present at all, really. But if it ends up in January or it's not perfectly wrapped, that's okay. She's going to love me anyway and appreciate me anyway. And so keeping in mind that if we're getting worked up, then we're probably losing the reason why we're doing it in the first place. And so really just practicing affirming the things that are good every day can help our mood. Getting engaged in those physical activities. I love walking, but I love walking so much more when I'm walking with a friend. And so keeping yourself engaged in those types of activities. Social activities can be good in appropriate ways. And so productive, pleasurable, and people are my 3 Ps that I try to get out to people every day. One of those every day can help keep our mood up, and I would just encourage everybody to do that during this time of the year, and pace yourself and remember why you're doing all of these things right now.
Well, we are very thankful for you, my friend. So glad that you were able to join us, even for just a short while. Great advice. Dr. Hamilton, have a wonderful day. Have a great holiday with your family. Stay safe.
Thank you. You as well.
All right, back to Dr. Silver. Okay, so we have some more. We're going to get to our community questions here in just a moment, but we've got some poison prevention tips for Thanksgiving. So we're just going to go through those so that people, as we're kind of prepping and getting ready for everything. So let's start with cleaning. That seems pretty basic. Tell us why so important.
Yeah. So it's important to clean the areas, that we're working with for prep work. It's also important not to clean and wash your turkey. That helps to stop preventing some of those bacteria. So one of the things people have sort of thought about is, take the turkey out, thaw it, and then wash it, thinking that it will actually decrease.
And you're splattering that all over the
Potentially,
place.
yes, you're actually just spreading those bacteria. So do not wash your turkey. Do not try to clean that up. It is important to clean the areas that you're working with, and keeping the poultry and raw meat separate from everything else.
Okay.
And cook it adequately.
Yes.
Cook it adequately. Okay, so what about storing food at the proper temperatures?
Yes, so
Talk
it's
about that.
important to not only cook the food at the at the right temperatures and important temperatures, but also to store them appropriately. At least refrigerate at least at 40 degrees Fahrenheit is typically our kind of go-to when we're actually storing the food and after it's cooked.
But that stuff sits out. What happens with that? I mean, it sits out. People go by, they stick their big fork in it, and maybe not this year with eating
Yeah.
after each other. But that's just what we just leave it out. And
Yeah.
is that really a concern people need to be thinking about?
So there are recommendations on how long you should leave food out based on sort of the temperature. If it's a really hot summer day, like greater than 90 degrees Fahrenheit, which luckily right here we're not worrying about in the Midwest. But if it is really hot, they typically don't recommend you leave it out more than an hour before you actually go back to store it in the refrigerator. This time of day, room temperature, about 2 hours you have before you want to put it back in the refrigerator.
All right, good tip to remember. What about separate?
Separate is also very important to prevent any of those foodborne illnesses. So keeping your raw poultry, meat, other products separate from your vegetables, other food products that would not normally contain those bacteria, and also storing them separately in the refrigerator as well.
All right. Okay, I want to. Oh, and then we have one last one, guys. Yep. Let's do that one. Cook. How do we cook it?
Cook is also important. I think Dr. Hawkinson alluded to this appropriately. We want to make sure that you reach the adequate internal temperature. So cooking turkeys, as that's the most common type of protein that we see in Thanksgiving, reach an internal temperature of 165 degrees Fahrenheit.
All right, so get out those little
meat thermometers.
You got to. That's that thing you never use throughout the entire year, but you got to bring it out this time. Okay, I want to get to some community questions because we've got a few coming in for you. Let's get to those. Okay, Isaac wants to know, have foodborne illnesses become a lot more common during the pandemic? I'm guessing they probably have because for regulators, more attention on COVID, less attention on food safety. Mm-hmm. So maybe people not paying attention to things like that as much. Just what are your thoughts? Have you seen any statistics on?
That's a good question. I haven't personally seen a major increase at the Poison Center. That hasn't been something that's stood out to me. We certainly get routine, regular calls about, patients who think, they might have foodborne illness, or that they're worried that, can I eat this? Is it safe? Will I get sick if I eat this? But nothing that's actually stood out as a major increase from what I've seen at the Poison Center, at least.
Okay. Just kind of jumping around. Craig wants to know, are we going to be getting boosters every 6 months? Just a random booster question for you, Dr. Hawkinson.
Yeah, I mean, again, so even if you haven't gotten your booster, if you are under 65, if you don't have significant comorbidities, you are still very well protected from the vaccine that you got early on in the year. So, we know that immunity will last and continue to protect you from hospitalization for that 8 to 12 months. I don't think we have enough data to really say exactly what the process will be moving forward, but we know for those that are over 65, certainly those boosters are, and the data has shown that they are very influential and beneficial in continuing to protect you from that risk of going to the hospital. So overall, the story is not there yet. We don't have enough data to suggest what is going to happen now after this last line of recommendations about really boosters for all, what that will be. So I think we still need to kind of wait and see what happens within these next 6 to 8 months. However, again, especially if you're under 65, if you got your vaccine in January, February, March, you are still very well protected from that risk of going to the hospital in the ICU.
Okay, so I'm sure this is also a topic that's going to be brought up at the dinner table. Mm-hmm. Donnie is asking, I have heard from many that they feel they have immunity already because they have or may have had COVID. Are there any studies that address actual immunity from the virus?
Yeah, there actually are, and there's a good amount of studies. But what we have seen is that people who have gotten the vaccination, number one, are less likely to be reinfected if they've had it in the past. There was a good morbidity and mortality weekly report out of the CDC about that. But also there is more and more evidence coming out to suggest that those people who get vaccine have a broader antibody response to variants of concern that may be circulating, even if they were infected, as compared to the people who were just infected but have not received the vaccine. So you have that robust immune response to create a broader amount of neutralizing antibodies. And that's the best information that we have. And again, the recommendation is still to get vaccinated even after infection.
Okay, a few more COVID questions, then we're going to jump back into the food topic. Sean wants to know, why aren't boosters recommended for 12 to 18 yet?
Yeah, good question. I think mostly because it hasn't been studied. We know that population is still very vulnerable in general. All populations are. And we know that, especially in Israel, I think they are now allowing 5 to 11-year-olds to get vaccination because they have seen that is where their highest increase of cases is. So we know that those people, younger people, are at risk of getting getting infected and having COVID. Again, the data is not there for that younger age group. I anticipate there probably will be. We've seen all of this data on all these age groups come out on needing booster, not needing booster. I suspect there will be some information coming out about that fairly soon. But as of yet, there is, just as you said, there is no recommendation to get a booster for that age. We'll see what happens in the next few weeks.
We've gotten several questions about this, so I hope this answers it. But Mark is asking, safety of gathering with children who only have one vaccination, and just talk about the idea that there's going to be some kids under 5 who haven't been vaccinated. So kids 5 to 11 that only have one, and then gathering with kids that don't have any. What is your advice to folks as they're gathering?
Yeah. Do you want to take that first or no? And we've talked about this before too. It's going to really come down to every individual or every individual's bubble and family to assess that type of risk. We know that you do start to mount some sort of immune response, in that 10 to 14 day period after that first vaccine dose. However, you are not fully protected until 14 days really after that second dose. So while you will have some immunity as somebody who's gotten one dose as a child, we know that you can still get it, you can still transmit it, and it's really going to be down to that individual's bubble and how comfortable do you feel in that group gathering setting. And so I think that is very important to understand. You will have some partial protection as an individual after that first dose, probably by about 10 to 14 days, but you are not going to receive that full protection to even help prevent against getting infected until really 14 days after that second dose. So I hope that helps answer that question a little bit.
Ashley wants to know, is the vaccine being altered at all to accommodate the new strains of COVID?
Initially we saw that Moderna in particular was trying to make some altered mRNA vaccine, and I think it was to the South African variant. But what we have seen is that the current vaccines continue to provide very good protection against all of the variants of concern. And that goes back to one of my questions that I answered earlier. We have seen that the vaccination helps continue to promote that immune system evolution so that you can develop those antibodies to those variants that you haven't even seen yet. And that is one of the wonders of our immune system, that those vaccines promote that evolution of that antibody and T-cell response very good, where right now we haven't found a need to necessarily have to create a vaccine specifically toward that variant, for example, for Delta itself. And so I think that is a very good thing, and we should all be happy about that. But we know that the vaccine companies are working on that should we see that the vaccine immunity that is produced isn't working anymore because of the current spike that they're using for that mRNA vaccine.
All right, Dr. Silver, you're up. So this is a great question. Isaac's asking, if it's very cold at night, below freezing, is it safe to store meat outside, do you think?
That's a good question.
Where do you put that big old turkey?
I mean, if it is below freezing, then why not use outside? I mean, before there were freezers and refrigerators, that was what we used. I can say I've personally done that at home.
Yeah.
So absolutely, if the temperature is appropriate to store that food, then go for it.
Yeah, just make sure the raccoons don't get it.
That's what I was going to
true.
say. But yeah,
Wild animals might have a different idea.
they would like that. Okay, so we ask this question. Okay, Debbie has a good one, and both of you can jump in on this. COVID-19 can cause gastro symptoms that could be similar to foodborne illness. Any tips on how to tell the difference? Is it if you feel better after a day or two? Do you still suggest testing for COVID?
So that's a good question. I think because there's so many different viruses or bacteria that can cause foodborne illness, there's differences in not only a little bit sometimes the symptoms and the severity, but also the onset is something that we tend to look at. So depending on if there's a delay in symptoms, if there's a resolution of those symptoms over a certain period of time, what those symptoms evolve to be. And then also, especially if at Thanksgiving dinner and people are eating the same food, are more than just you sick? Is it the whole family that ate that turkey since it was, only cooked to a temperature of 150, for example, and then multiple people end up getting sick overnight or the next day? Those are things that sort of would clue us in that it would be more of a food-based illness as opposed to COVID.
Yeah.
Dr. Hawkinson, anything to add?
I would agree. And for a lot of these foodborne illnesses, especially these viruses that we've heard about, it starts in the upper gastrointestinal tract with maybe some nausea, vomiting, and then later on will progress to that lower gastrointestinal tract with the symptoms of the diarrhea. We know COVID can cause some GI symptoms, but that is not the preponderance of symptoms, and you would probably also expect other symptoms as well, such as respiratory type symptoms, either in the upper respiratory tract or, of course, lower respiratory tract, like with cough. But it is difficult to tell. But I think, a lot of these, as we just heard as well, are transient. So they're very short-lived, 24, 48 hours, things like that. If there is any question, certainly you can go get tested for COVID. But understand that there is some overlap in those symptoms, but generally those are the only symptoms you would get for the viral foodborne illness, and it's relatively quickly, it spontaneously resolves fairly quickly. Just remember, if you do get those symptoms, please try to stay hydrated as much as possible.
Good advice. Okay, this is a great question, and I think it's going to be the last one. Any known cases of COVID being spread through food? That was a big fear early on, people wiping things down, restaurants being extra cautious. So do we know anything about that? Any concerns? Should there still be them?
I personally don't know of any case that was directly linked to food. That's from my view at the Poison Center.
Yeah.
We do get some COVID-related calls and questions, but nothing that we've personally seen with that.
Yeah.
So have we let down our guard a little bit, Dr. Hawkinson, with being concerned about being around food? Or
I wouldn't say let down our guard, but I would say that we understand what those high-risk situations are. And if you're delivering food to somebody, I think you can feel pretty well at ease that you will not give them COVID-19. We know that there are those receptors in the gastrointestinal tract for the virus, and it can cause some GI symptoms, as we had just talked about. But the preponderance of cases that have occurred are because of that human behavior where people are gathering close together, not necessarily spread through those fomites. That is much more rare or infrequent. It's more important about those gathering indoors, being close together with other people, where really you're going to see that spread.
all right, we're going to get to some cute kid pics here in just a few minutes, but I want to get our final thoughts. Dr. Silver, I'll start with you.
Yeah, so final thoughts. Our number is 1-800-222-1222. It's a completely free number. We are available 24/7, holidays, weekends, regardless. Even if you are traveling, that number will still get you to your local poison center. So we are one of 55 poison centers. If you're traveling, keep medication stored away, or if you're going to a place that also has medications, just watch out for those, for your kids to get into them. Make sure that they're stored appropriately. And when in doubt, give us a call.
Good stuff today. Thanks so much.
Yeah.
I'm so glad you were with us. Have a great holiday.
Thanks for having me.
You bet.
You too.
You bet. Dr. Hawkinson.
I know you've probably been waiting for with bated breath for this this final comment.
Oh, do I
and
get
maybe
a-
that answer for your
I get a
first
graph?
question, which I don't know if you reviewed all this data before I did today, because from what we have, this is from KC Star, and again they they regularly report, the average seven day rolling cases. That's in that red line there. This is from November 17th, so it's a little bit backed up. But if you look at 1 year ago today, on November 23rd, we had our highest 7-day average, and that's that peak there right in the middle. 1,182 cases was the rolling 7-day average. As you get down to that nadir, that lowest point in early June, we were down to 53 cases as the rolling 7-day average. And then we saw this most recent peak that occurred on August 14th, 766 cases per day in the rolling 7-day average. But as you can see, more concerning is if you get toward that right edge over there, you'll see that low point right there is nowhere near what the low point was back in June. And as of last week, we were at the rolling 7-day average of 326 cases a day. And so that is really the concern. If the cases continue to go up, what will happen in 2 or 3 weeks when we start to expect to see those hospitalizations? The other final thought is, we know that Governor Kelly made a proclamation of Antibiotics Awareness Week, and that was November 18th through the 24th, so we're nearly done with that. But I think it's important to understand, we've been talking a lot about illness here. It's important to understand that a lot of these illnesses that we are going to be seeing, especially through the respiratory viral season, are viruses, and that it's important to use antibiotics correctly. Just a few points. Kansas is the eighth highest antibiotic prescribing state in the country, and it's in the bottom 3 states for implementation of antibiotic stewardship programs in healthcare facilities. We have a fairly strong antibiotic stewardship program here. I worked in it, continue to still be involved with it. We have Dr. Shoemaker, Dr. Kimball, and some really good infectious disease pharmacists led by Nikki Wilson to help us with that, to really understand, number one, do you need antibiotics when you come to the hospital, and what are the appropriate antibiotics? Because we know all drugs can cause side effects, just as we heard earlier in this talk. And so we really want to make sure that we give you the antibiotics when you need them and don't give them to you when you don't need them, and really watch for those other side effects that can occur. Also, over 2.8 million people in the United States develop an antibiotic-resistant infection each year, and over 35,000 of those people die. So again, it's very important to really understand, do you necessarily need antibiotics? And we want to give you the right ones so that we can prevent all of these things from occurring and really keep you in your best health and best quality of life.
I did review all that data, and you did a really good job.
Yeah, well, you caught me off guard. So.
I know, you did good. You did good. Okay, so we do want you to continue to send in photos of your kids getting the COVID-19 vaccine. Check out these pictures. Yep, showing off their happy faces, their Band-Aids, these brave kids, now vaccinated kids. It's an exciting time for many of them, but not all kids are excited to do this. It can really help those kids when they see other kids like this stepping up in line and getting their shot. So we appreciate you sending those in. We appreciate your kids doing it. You can send your photos to us here by posting them on our Facebook page or emailing them to the Medical News Network. Okay, so everyone, thank you so much for being with us today. Do not forget, you can catch us anytime on our Facebook page or check us out on YouTube, our YouTube channel there for you. So tomorrow, Dr. Hawkinson mentioned it, more and more people becoming sick and requiring antibiotics. Yes, Kansas, number 8 in the nation for prescribing them. So what's happening now is the viruses are beating out the treatment that you are being prescribed. So we're going to talk about what's being done to prevent this and what's being done to turn this around. That is tomorrow, right here on the show, starting at 8 a.m. Have a great Tuesday. We'll see you then.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.